Thank you for joining us. You're listening to the Beyond 50 radio program. I'm your host, Daniel Davis. Joining us on the program today is someone who's going to be talking about some of the reasons why we feel tired for no reason. If you're having trouble getting up in the morning, we need coffee to get us jump-started. How about colas, salty, or some of them amp drinks that we find at 7-Eleven or our grocery stores that try to get us moved and juiced and moving along fine? How about feeling run down or stressed? Do you feel those things as well? Well, our guest joining us here on the Beyond 50 radio program today is provider of education for ZRT Laboratories, which is located in Beaverton, Oregon. More than 25 years of experience in bioidentical hormone therapies, both in clinical practice and retail pharmacy. He's going to be talking with us today about how it is we're run down and what we can do about it. And I'd like to welcome to our program today Dr. Jim Paoletti, joining us here on the Beyond 50 radio program today to get us amped up naturally once we find out what it is that's causing us to be tired. Jim, thank you for joining us here on the Beyond 50 radio program.
Oh, thank you for having me.
Now, is it natural for us to just feel run down in today's stressed out, over-intoxicated world, or what's going on here?
Well, in a sense it is, in a sense it isn't. It's natural for us to feel that way with the stress we put on our adrenal glands and our cortisol issues that we have, but at the same time, that's not a natural state for the body to be, and that's why we have so many of those symptoms.
Now, let's talk about adrenal fatigue. What exactly are the adrenals for our listeners who may not have stayed awake in biology just for this very reason? And tell us how they affect the body.
Well, let's just keep it real simple. They're a gland that produces several substances in the body, hormones, which are messengers, including primarily cortisol, epinephrine, which affects your sympathetic nervous system, several of the sex steroids, and that varies in males and females. In females, it produces all of your DHEA and about half your testosterone, and then after menopause, it becomes the major source of estrogen and progesterone. In males, it is the primary source of DHEA and estrogen and progesterone, and then after andropause, the primary source for testosterone. It also produces aldosterone, which is a major regulator in blood pressure, and most importantly, the cortisol. It produces all kinds of stuff.
Mm-hmm. Now, I've heard a lot about DHEA. That seems to be really big on the horizon, especially for little sprouting nutraceutical companies that are out there. Let's talk about what that is so people have a better understanding about it, because there seems to be a lot of attention paid to that for some strange reason.
Well, it's just one of the last hormones to catch on.
I see.
But DHEA has primarily, I emphasize to people, there's two really important roles, and there may be more roles that are not yet proven, but one is a precursor to other hormones. In other words, it is converted to some of the other active hormones like testosterone and estrogen in both men and women, so it helps regulate the hormone balance. What is critical to me is DHEA plays a very important part in immune function. So if you want your immune system functioning optimally, you need DHEA at a good physiological level. And if your immune system's not operating correctly, then you are automatically at an increased risk for cancer, because it's your immune system that's responsible for repairing the damaged DNA that we all have going on in our bodies every day.
So it sounds to me like supporting a system that keeps DHEA in line is actually one of the ways that people can prevent an onset of cancer?
It decreases the risk, absolutely. When we talk, it's hard when you talk about hormones not to complete the entire picture of the endocrine function. When we look at a patient, we want to decrease risk like breast cancer risk. We've got to look at estrogen level, progesterone level, testosterone level, DHEA level, cortisol level, and thyroid level, because they all can affect your risk. So we attempt to balance all those properly and get them all back to the correct level.
Now, talk about what the adrenals are and what their function actually is in the body. I know you touched on it just a bit, but sometimes, our listening audience gets a little bit confused about all that, especially in a world of what seems to be a lot of, or at least a lot of misinformation.
Well, let's try to just simplify it. The cortisol the adrenal glands are responsible for so many different actions in the body with the hormones they release. But if I could just simply define the function of the adrenal glands enable you to handle everything. They help you handle physical stressors, mental stressors, emotional stressors, and they are the stimulant in the body. So they help you handle things and also stimulate you. Cortisol gives you the energy to get through the day. If you didn't have cortisol, you couldn't get out of bed.
Mm-hmm.
So those are two primary functions. But when it gets disrupted, it disrupts all these other hormone functions and balances, and that causes all kinds of symptoms.
Now let's talk about some of the symptoms that you're describing here.
Well, primary, fatigue. I mean, secondary, all kinds of things. Like you crave stimulants. If you're lacking cortisol, that's your main stimulant of your whole body, including your brain. Your brain wants a stimulant. And so you'll find people that are low on cortisol, they will crave sugar, caffeine, carbohydrates, nicotine, high-fat foods, salt and foods high in salt, anything that helps stimulate the brain. So, in fact, I often tell people, if I test you and your cortisol output's low, I'm not going to ask you to give up caffeine and nicotine right now because I find that's very, very difficult to do. I'm going to ask you to cut back on it because it's not good for your adrenals to drink too much caffeine. But in the meantime, I'm going to say, let's work on your adrenal health for 6 months, and then maybe you can give it up successfully.
Mm-hmm. Now, how does aging affect things like your adrenals and your cortisol levels as well?
Well, there's two. Cortisol is unique. All our other hormones decline with age. As we just make less as we get older. But cortisol in the normal person that's not stressed out actually elevates with age. And that's one of the reasons why elderly people sleep less. But in nowadays, in our society nowadays, with all the stressors everybody has on a daily basis, what happens is the adrenals can't keep up. We only, of all the cortisol we make every day, there's only like 1.5% of it that's there as reserved to handle the increased stresses of the day. Well, people are stressed continuously, and what happens, the adrenal glands after a while say, I can't keep up. And then our cortisol levels, when they're first stressed and they're able to make plenty, cortisol's high, and you have a certain set of symptoms, including increased energy. But then as you lose the ability to make that cortisol, because you've just tired your adrenal glands out, they give up. They say, I give up. I can't do this anymore. Mm-hmm. Your cortisol levels start to drop, and now you run into symptoms like lethargic feelings, apathy, tired, depression, decreased ability to handle stressors of all kinds. You become irritable, all those food cravings I talked about, decreased sex drive, orthostatic hypotension, low blood pressure, muscular weakness, allergy symptoms, swelling, hypothyroid symptoms. Oh, the list goes on and on.
Sounds to me like somebody's a real mess.
Oh, yeah. And people go through this in stages. And I don't use the word adrenal fatigue too much because that's the end point. That's when your adrenals are just not kicking out any cortisol at all. Many, many people suffer from adrenal dysfunction, and that is where you're not making the normal amount of cortisol, and you're starting to suffer all these symptoms. I don't want to wait till you're adrenal fatigue because then you are flatlined. You are really hurting. If I see patients that are adrenally dysfunctional, I like to get it right then, and let's start treating it. Let's support the adrenals. Let's talk about your lifestyle. Let's change this before you become so bad off that you're not going to be able to get out of bed.
Mm-hmm. Now, let's talk about the stressors that are out there that most of us would probably encounter that would cause these things to become depleted.
I'm glad you asked that. I have such a good time when people tell me I'm not stressed. I said, stressors include physical, mental, and emotional. Death of a loved one, infections, all the toxins you're exposed to, the pressures of everyday life, financial pressures. Two of the biggest stressors, work and guilt. Not taking enough relaxation is a stress. Fears, any kind of fear, coffee, caffeine, nicotine. How many people have marital stress, financial stress? Poor diet is stressful on your adrenals. There are many drugs that are stressful. Wound healing, any kind of surgery or major wound healing is very stressful on the adrenals. When I said lack of good food, sugar and white flour products, they're stressful. Lack of good exercise, stressful. Lack of sleep, very stressful. Smoking. Is there anybody out there we haven't hit on yet?
How about cell phones?
Cell phones they cause inflammation in the body, and inflammation is stress. So, I tell people, number one, don't hold that thing against your head. Never use a Bluetooth. That inflames the whole side of your head. You talk for a minute, your head will be inflamed internally, brain-wise, for at least 15, 20 minutes. Try to use earphones, and if you can, get the kind that are the signals conducted by air, and you are reducing the stressful inflammatory effects in the brain. But all these stressors, the thing is, they're cumulative and additive over time. When we're young, we're able to cope with so much. Think of the kids and what they do in school, sports-wise and studying, and kids in college, and people that are in their 20s and work. They're so go and so productive. And then as we get older, we start to lose that. We get burned out. Well, that's because the effect on the adrenals over the years of all these different stressors, it's additive and it's cumulative. If you've had the death of a loved one 2 or 3 years ago and it took you 6 months to get over, you're mentally over that now, but unless you've done something to nutritionally support your adrenal glands are still suffering the effect of that stress from 2 years ago or 6 years ago. And so these add up over time. This adrenal dysfunction, adrenal fatigue, is a time disease. It occurs, it starts when we're much younger and occurs over time.
Though, it's interesting that you bring up, the young Jim, is because it seems this day and age that I'm coming across more and more young people that seem to always be tired. What's up with that?
Absolutely. And I think that's environmental. If you look at the age of the onset of puberty in young females, it's basically stayed the same age for decades. And then in the last two decades, the last 15 years, it has lowered on the average 18 months. 18 months for something. That is definitely our environment. All these things that we're exposed to, the radiations, electric currents, the chemicals, the pollutants, the pesticides, etc., those are all toxins. And they mess up the immune system. They'll mess up in a woman. They'll mess up the estrogen-progesterone balance in her cycle. But in many patients, what they do is they mess up the liver. The liver's having a hard time detoxifying all these things, and that stresses your adrenals. So, yes. And when your adrenals are stressed and your liver's not detoxifying, that affects your thyroid function, which definitely affects you take the cortisol issues from the adrenals and the thyroid, put them together, and you'll find a lot of fatigue. And, yes, I agree with you. 10, 15 years ago, I did not see nearly the number of problems hormonally and endocrine-wise in younger individuals that I am seeing today. It's had a tremendous increase. And I think, we always say, I was stressed, when I was high school and college too, but my personal perspective, there's more stress in these kids today than there ever has been.
And I agree with that too, because it seems to me, we could have just went on and on and on unless you were somebody who was, of course, involved with sports and you'd kind of get naturally tired. But the fact is, it's like these kids, they sleep a lot longer than they used to, and you kind of wonder, what's really going on with them? Is it psychological? What is it? But you're saying that it's mostly the environment.
Well, that and the fact that if you look at the adrenals, nutritionally, they demand more nutrition for support of the gland than any other gland in the body, including the brain and the heart. How many of these kids are eating well? The processed food that we have available today for fast food, et cetera, and even what we take home and cook, it's really poor quality compared to what we've had in the past, and it's getting worse. So we're not putting the right nutrition into the body. And how many younger kids bother to take a vitamin and mineral every day, much less something to support their adrenals? Mm-hmm. So I think what you're seeing is additive stuff, everything going together, the changes in the environment, the changes in the stress, the changes in nutrition that are just showing up in younger individuals.
Oh, fascinating. Now, how can somebody begin to do something about it if they feel that their adrenals are becoming stressed? What are steps that a person can take, let's say, at any age?
Well, number one, you need to assess where you're at. Like I said, adrenal dysfunction occurs in stages, and to properly treat it, we need to find out where your cortisol is during the day. And so that's usually done through saliva testing. By far the very, very best way to do it. The conventional blood serum testing out of your arm does not help with cortisol. So we ask them to spit in a tube 4 times a day, and that gives me their pattern of cortisol during the day. I need to know if you're running high cortisol all day, high in the morning, low the rest of the day, high in the morning and high at night, low during the day, et cetera, to know how to treat you as an individual. So that's number one. I guess number one is really symptom evaluation. I ask people to go over the list of symptoms of lack of or too much cortisol, and that tells me right there if they have an issue. Then the cortisol, along with testing their DHEA and testosterone, tell me what stage of adrenal dysfunction you are and what we can do to deal with that.
Now, what kinds of foods can actually increase cortisol production, I guess, or help the body get up to maximum levels of just good energy altogether?
Well, here's the thing. Cortisol and insulin resistance are highly intertwined. Fluctuations in the level of cortisol from the adrenal output causes fluctuation in insulin and which causes insulin resistance, which then affects your LH-FSH balance, which messes up your sex hormones. So, but cortisol and insulin, I mean, they're hand in hand. If you have a problem with one, you have a problem with another. So any of the foods you eat to increase insulin resistance is going to affect your adrenals poorly. And that's the sugar, the processed whites, foods, too much carbohydrates. I mean, it's really important if you have adrenal dysfunction. I emphasize to people, yeah, you need some carbohydrate, the good kind. Stay away from the white bread, the breads, etc. But you need mainly protein. You need good protein to build up your adrenal strength. So, and there are diets put out there. There's a great book by Dr. James Wilson called Adrenal Fatigue, the 21st Century Syndrome, and that talks about the right things to eat. Now, anybody that I find with adrenal dysfunction, or any doctor or nurse or health practitioner I'm trying to educate on it, that's my first requirement. Read that book. Many patients aren't to the point of adrenal fatigue, but they can recognize the symptoms. And then there's everything in that book, from breathing exercises to diet to things you can do, relaxation on a regular basis, to help counter this.
I think what's interesting, too, is we seem to be in a world this day and age where we just don't relax like we used to.
Well, that's one of the prescriptions I give. I give several prescriptions. I tell people, here's the thing. You can't get rid of your stressors, can you? I mean, what are you going to do? Shoot your spouse and give the kids away and quit your job? I mean, you've got stressors. So here's how I tell people to address stress. Number one, identify your stressors. Admit what stresses you. If you can avoid it, avoid it. If you would take a work break in the morning at 10 o'clock and you go to the break room and there's 3 or 4 other people you work with who sit at the table with every day, and all they do for that 15 or 20-minute break is complain about their work and how terrible it is, that's negative. You need to get away from those people. But you can't get away from all stressors, so you have to, what I call it is, I don't call it stress management. I hate that term, like we can really manage our stress.
Right.
I call it stress response. I call it stress response adaptation. You need to train yourself to respond to stress better, and you do that 2 ways. Number one, you have to learn to focus on the positives in your life. As human beings, we concentrate on negatives and we worry. So I tell everybody, I ask everybody, are you blessed at all in your life? Do you have? I mean, are you barefooted and no clothes and out in the street begging? You have something to be thankful for. You need to get up every morning and thank your Maker for whatever blessings you can think of. Try to think of a new one every day. You have to focus on the good things in your life. You have to concentrate, and that doesn't come natural. You have to work at that. The other thing you have to do is you have to find something regularly that releases stress. Exercise. Now, people are adrenaline fatigued. I'm not saying competitive. I'm not saying exercise that just fatigues you out. I mean, 10 minutes of walking a day. If that tires you out, 5 minutes. Do something. It could be prayer, meditation. It could be simply going outside your house in the backyard and yelling at the top of your lungs, because that makes you feel good. If you practice relieving stress on a regular basis and you schedule something every day that, one, you enjoy, 2, relieves your stress, then when you do come upon the stressors and you focus on the positive, your response to the stress is much less intense on the adrenals. So and I tell people, it takes you 6 months to a year to learn how to adapt your stress response. If you don't practice it every day, at least once a day, you'll never get there. Once you get there, it's amazing how much better you can handle everything around you.
You know, it's interesting, Jim, in the more than 6 years we've been producing this program, we've tried to come up with very creative ways for people to approach stress, because obviously stress can create the inflammation, which creates a whole list of problems. And today we're talking about how we're stressing our adrenals through different ways and shapes and forms. And as we get older, that stress seems to kind of compound a little bit, because we think, okay, now we're at a point where we have a lot less time. There's retirement. Am I going to be prepared for all these things? I'm aging. You know, I'm on my way. I'm dying. Whatever the case is.
Yeah.
And what's really fascinating is a couple of things that have came up that I might even suggest to our listeners, and by all means, you feel free to agree or disagree. But one of the things is to take up creative arts, something that you really enlist in your creativity. And the other thing too is, it was actually a piece of advice that my own wife had given, and she says, you know, every 6 months, learn a new skill. And when you think about, for instance, the movie Groundhog Day, that's exactly what Bill Murray, you know, the character in the movie, finally says, okay, I'm tired of seeing how many ways I can cheat life knowing I'm going to wake up the next day regardless. What am I going to do with my day? And we find that as we get older sometimes, we're kind of like that old dog that just doesn't want to learn new tricks. And wouldn't you find that to be a primary way for a person to really feel alive? That if, just for instance, every 6 months you thought, I want to learn a new skill. And this day and age, there's a whole lot of opportunities for somebody to pursue that.
Well, I like that idea so much. I want to work that into my presentation on adrenals if I can. That is a great way to put it. I always tell people there's 2 things you have to do. Prepare for the stress, as we mentioned, and 2, do something in your life you like to do on a regular basis. That's the creative arts. And everybody's different. You're doing it for yourself. You're taking care of everybody else in your family. You're worried about everybody else. Take care of yourself.
Exactly.
Hey, I got a question to ask you. Do you see very many perimenopausal women that do not have adrenal issues?
Not too many that I know of.
No. When you think about it, women are stressed extremely. I mean, they have to be a great mother, a great spouse. They take care of their parents nowadays because they're living older, so they have to continue to be a great daughter, and they have to bring home a good slice of the bacon, too. We can't stress them much more. Additive and cumulative. They get to perimenopause, their hair starts falling out, they're gaining weight. They worry about what they're going to look like. They can't remember where their keys are, their kid's first name. They're worried about getting Alzheimer's. They can't multitask, they can't remember, they can't focus at work, they're irritable, they snap to coworkers. They worry about taking their jobs. It is no wonder in my mind that perimenopausal women, for the most part, have some degree of adrenal dysfunction because of all the stress that's been adding up for years, and now they hit perimenopause, and they start falling apart, and they worry about what's going to happen to them. Mm-hmm. Men, it's a little bit slower onset. You know, we put up, the problem with men is when our testosterone goes down and our estrogen goes up, we become so lethargic we don't really care that we're falling apart.
Mm-hmm. You know, and then add to which then the women are usually taking care of either aging parents or grandchildren on top of it, so it makes it even harder.
No. Yeah, it's tough on women, and the thing is women can handle stress better overall because they are excellent communicators. If you put 4 women who don't know each other at a meeting together at lunch, by the end of the hour they know each other's lives. But if you put 4 of us guys together, the reason you see cortisol issues in guys, and I see them in the age range of 30 to 35 and mid-50s on, when guys are worried about, am I in the right life, you know, right career, am I married to the right person, am I going to pay for the education, or how am I going to afford retirement, etc. But guys, the problem with guys, if you and I and 2 other guys go out for lunch, what do we talk about? Sports. We make joke about our wives, but you know, sports and fun things. Guys do not communicate their worries and fears to other guys. That's just not a thing a guy does. I mean, who does a guy talk to about the fact that I don't think I'm going to have the money to pay for my kid's education? He doesn't tell his wife. He can't tell his coworker. Who does he tell? Nobody. So guys suppress a lot of their stress issues, and that's why they have adrenal issues.
Mm-hmm. Now, Jim, if you can, tell our listeners about the role of ZRT Laboratory when it comes to the discussion that we're having here about stressed adrenals and what we can do about it.
Well, ZRT, and I may sound biased, but let me first explain that I worked as a consultant for hormones for over 11 years before I became a member of ZRT, and I've seen every test lab out there, every fluid you can test, and that's why I'm with ZRT, because they do the very best job. But you can do a panel. You can do just your 4 cortisols and testosterone DHA, but I tell people we need to look at your estrogen and progesterone at the same time. We start with at least that panel where they can they go to www.zrtlab.com and get all this information. It's all there. It tells you about the different symptoms, tells you about what you can test, and they can get a test kit themselves, or they can go to one of our providing pharmacists or practitioners and get a test kit. And it's a simple matter of spitting in a tube. If you want to include thyroid and vitamin D, we have to prick your finger and also get a few drops of blood. But for our basic starting point, and a lot of people, I just say, hey, if you'll just give me your saliva 4 times a day, give me a fairly decent amount in the morning, and then during the day 3 other times, just a little bit. I'll measure your cortisol 4 times. I'll measure the rest of your sex steroids in the morning. And our report will correlate your symptoms to where the problems may lay, so we can correlate your symptoms and the levels, and then it gives you a readout that says, what do those numbers mean? So you don't get a test result back with just some numbers tell you your normal, high, or low. You actually get to read about what do these numbers mean, and it'll even make suggestions. I mean, we even make book suggestions. You might want to read this. You might want to consider this. We don't tell people what they have to do, but we try to steer them in the right direction, and we work closely with our practitioners who have looked at these tests for years, and we have 4 doctors on staff that can help them. So we treat every person as an individual in analyzing their results and then addressing what has to be addressed first, what's primary, and getting them to feel better. And I'll tell you, most people, it's not one thing or another. A lot of people may be listening and they hear these symptoms, they think, oh, I've got adrenal dysfunction. Adrenal dysfunction symptoms overlap with other hormone imbalances and deficiencies. So we have to look and see if your symptoms are caused by just a cortisol issue, or is it caused by cortisol and lack of progesterone, or is it cortisol and lack of testosterone, or do you have cortisol and thyroid? You can't address one part of the system and expect to fix all the symptoms. In most patients, we're addressing 2, maybe 3 different issues, to different severities, but everybody has some hormone issues by the time we get into our 40s and 50s, in my opinion. Mm-hmm. Rare not to.
Now, Jim, is there a website people can find out more about all of this?
Yes, they can go to www.zrtlab.com. We have everything I've talked about. We have information for the patients there. We have videos, little short videos you can watch in each one of these. We can get a video. Want to see how we do a spit test or how we do a blood spot test? You can click on the video. But we have a lot of information there. Our website is designed to provide the patients with all the information they need to get going on this and help take care of themselves. We try to empower patients with the knowledge, and the IT people work with them just an excellent job with our website.
You know, it seems interesting that we're moving in such creative times when it comes to healthcare, where people are really beginning to get into the driver's seat and to have things such as ZRT Lab available to be able to, go ahead and, out of their home be able to test and then be able to take the next steps based on the suggestions that you make there to be able to, basically become their own doctor. It's very encouraging.
And that's why I love doing radio interviews like yours. You're helping so many people, because I've always thought the main thing we have to do is we just empower people with the knowledge to make wise choices and how to proceed in taking their own health. People will take charge, and that's the only way they're really going to get better with the way our medical system is set up today. If you depend upon a drug, then you're dependent upon a doctor, then you're dependent upon drugs, and you're never treating underlying causes. Especially when it comes to hormones, it's just a matter of rebalancing the hormones correctly. And the more people we can get to understand that, hey, you're in charge. We'll give you the information, but you're in charge, the better off we'll be as a society.
Mm-hmm. Always a fascinating subject whenever I have ZRT Labs on the program. I want to thank you for joining us again. And please, Jim, give out your website again.
www.ZRTLab.com.
Dr. Jim Paoletti, thank you for joining us here on the Beyond 50 radio program. I feel less stressed already.
Breathe deep. Thank you very much, Daniel. I certainly enjoyed it.
Thank you very much. We also encourage you, the listeners, thank you for joining us here on the program, and be sure to visit us at our website at beyond50radio.com. That's the number 50 with a 50, and sign up for our free weekly e-newsletter. Be sure also to visit our blog. Multimedia is right there at your fingertips, where we archive our shows, have great YouTube videos, and resource information and hot links where you can go ahead and reach out to the information that we love providing for you as well. We thank you for tuning in. This is the Beyond 50 radio program. I'm Daniel Davis, and remember, live your day past halfway.